So I will go ahead and get started. So let me go ahead and share my screen here. All right. So welcome everybody. So this is our prioritization day. Why did that move forward? I didn't do anything there. That's weird. So yeah, this is kind of almost the culmination of the process so far. So today is we've gathered all the data, we've done our focus groups, we've done our surveys, we've published the kind of the draft report, and today is the day we decide together what we want our priorities to be for this effort. And as part of that, we'll just kind of refresh everybody. For those who have been here, we'll get everybody who maybe this is their first time kind of acquainted with the process and where we are so far. And so let's get underway. So what we've done so far, this is kind of a list of kind of a brief list of everything that we've done so far. We have pulled data for 31 different indicators. So those were originally chosen way back in, I think it was December. We had a meeting where we kicked off and we reviewed our indicators. And then for those, after a whole bunch of months in July or in August, it was actually August, we had our data party. So we were able to preview a good number of those. It wasn't all of them, which is why we'll be going over some more of it today. And then since then, we've also had some more qualitative data. So those are our stories, our focus groups, our surveys, where we get input from traditionally underserved populations, usually folks who are unemployed or on Medicaid, folks with disabilities, or those who are in recovery. And this time around, we did have 5 focus groups. And that is to go along with our community surveys. So our community surveys were extremely successful this time around. I believe last cycle we had somewhere around 400 completed surveys, and this time we had over 1,000. So quite a good turnout. Some of that is probably because, as Anne had called you guys before, we had a bit of a captive audience where we would share our surveys. And that was in kind of clinics and all around in any venue we could. People are a lot more attached to social media at this point. So we had a little bit more reach probably compared to previous cycles. We did also have a very good turnout for our healthcare provider survey. Sort of the similar things there. We had, I think, 40 instead of 30 this time around. So a real good response there. We have done our asset maps. So those are present on our Healthy Capital County's website. They are interactive. They highlight, this time around, it was chosen as mental health and recovery resources, behavioral health resources, and food systems assets. So those are all present on our Google Maps, and you can filter them as you see fit. So I know that was something people have been asking for a little while, and we were able to do it this time, which is exciting. We have, in terms of outreach, kept people as up to date as we can. It has been challenging for the health department to kind of keep up with everybody. We have to kind of balance where we have COVID versus, kind of message saturation. But I think we've done a good job of getting everything out there as much as we can. We did originally publish the Healthy Capital County's report on October 20th. So that is the day you got an email from me about the report being out. And then today we are doing prioritization. So if you're joining us for the first time, I thought I'd take a minute to just kind of tell you where this process comes from and why we do it. This goes all the way back to 2010 when the Affordable Care Act was passed. In that, it set forth some requirements for hospitals and IRS requirements to maintain nonprofit status. And along with that, the Public Health Accreditation Bureau also has requirements for their accreditation for our local health departments. And a lot of those requirements overlap. So it made some sense for the hospital systems and for our health departments in the area to work together towards this report. And so we've been doing it in 2010 with their first report published in 2012, and we are now on our 4th cycle. So this is a once every 3-year endeavor. And our initial definition for what we've used for this is a community health needs assessment and improvement plan is a systematic process involving a community to identify and analyze community health needs and assets, prioritize those needs, which is what we're doing today, and then implement a plan to address any significant unmet needs, which is what we will discuss kind of at the end as we formulate our plan moving forward into the next part of this cycle.
Yeah, and I'll just share that I think this is the first cycle where all three health departments have been FAB accredited. So congrats to Mid-Michigan and Ingham and us for all being accredited, nationally accredited health departments.
I did not know that. That is good information. All right, so this is kind of just another way to visualize the health improvement cycle. So kind of the definition that we had, but put into visual form. So we have just done the community health assessment. That is what we published. And from that, we will choose the priorities. Again, that's today. Those priorities will then inform the community health improvement plan. And then from those, we'll get our actions. We'll have about a year where we monitor and evaluate how we're doing with those. We'll update our data and the process will go again. And again, this is once every about 3 years. And that went backwards for no reason. Okay. This is the model that we sort of based it off of initially. So this is from the Association for Community Health Improvement. This is kind of our basis now. We're very good at, we know what we're doing at this point. We have the cycle baked into everything we're doing. But this is the initial thing that we had started with to kind of get ourselves used to the process. But luckily at this point, we kind of have it down pat. So we are comfortable with where we're at. So now we'll go into a little bit of a sneak peek of our report. So that is the cover of our report. We've had 3 other reports that we've published. So in the report, there's introduction, which kind of goes over all the different things we've done, the summary of key findings. So the things we found in our data, in our focus groups, in a summary form, our indicator section. So that is where we get the more detailed information and where a lot of our graphs and breakouts are done. Speaking of health is our qualitative information, so our focus groups. We have a little narrative in there, kind of broken down by the way we did. We wrote out the questions. So we kind of made a narrative out of what they told us and supported it with quotes. I think it's a pretty cool way to display it. Challenging to do, but an interesting way to display it. And then we have our community input. So those are our surveys, our asset inventory, which is the maps. And then the last part that we will add is again today for prioritization. This is our fancy rainbow table. So this is supposed to be a kind of quick way to kind of go through each measure and be able to tell fairly quickly what it says and if there's any comparisons that are worth displaying. So whether that is, an area performs less well than other areas, whether there is a disparity based on race, on gender, or age, we would do that. We showed trend data were available. We are looking for at least 3 points to do a trend. And then, of course, if there are 2 or more concerns, we would put the exclamation mark there to address that. And before we move forward, I want to take a minute to just acknowledge everybody who's helped us with the process and who's been involved. So our hospital partners at Eaton Rapids Medical Center, at McLaren, at Sparrow, and then my colleagues at Ingham County and Mid-Michigan. It's been a long process and everybody's been so incredibly helpful and supportive. We really are thankful for your involvement in all of this. And specifically to our staff, to Anne for helping me kind of guide this through it, to Kristen for helping for Michigan or for Ingham, Rex for Mid-Michigan, my colleague Emily has helped me coordinate and get all the messages out, Susan and Janine for pulling the data, and then some folks who aren't with us, Jonas Mator and our intern Jessa, who helped me learn how to analyze focus groups. Again, all of your input has been truly important and it made it a lot easier than it could have been. So thank you very much. And so that brings us to our big problem. We have a lot of data to go through in the presentation. We did touch on some of it already in the virtual data tour, but that was only some of it, and that was 3 months ago. So there is still a lot more to touch on before we do it, and we are going to take some time in a little while to do so. So we're going to kind of have a little activity to walk everybody through, to make them look through the report and get familiar with it if you haven't done so already. Because, as it says here, it takes up 89 pages of the report, and we have point in time data, we have trend data, we have breakouts. So there is a lot to go through, and we want to make sure that by the time we come to the prioritization vote, everyone has had a good opportunity to look at it and to at least feel a little bit comfortable with it. But before we do that, I just wanted to talk a little bit about something we didn't have too much information on at the data party in August, and that is our community input and focus groups. So we use these alongside our quantitative data to kind of enrich it and to kind of get the direct thoughts and quotes from folks in the community using their own words. It is especially beneficial for those who are in those traditionally vulnerable groups and who are often underrepresented in the other survey methodologies. We had about 26 total participants through 5 groups, and we have developed 3 concept maps, which will be the next things that we show that kind of highlight important things that we found and important quotes and areas of concern from those interviews and focus groups. Our first one is the discussion of things in our communities that either help us be healthy or things that make it harder to be healthy. And for this, I'm going to start out with things that help people be healthy. So in terms of bigger categories, folks felt there were things in their physical environment that helped them be healthy. And among those were the trails and parks that were readily available in the area, farmers markets, and not just farmers markets, but community gardens, so that really healthy, fresh foods was a big point of emphasis that people thought they were able to get relatively easy among some of the groups. In terms of programs and resources, food assistance programs have been a big help to those who are generally underserved. There was a good mention that like the SNAP Ed classes, nutrition education was beneficial and helped people learn how to use those fresh foods that they were able to get at the farmers markets and grow at the community gardens or through other means. And then people did enjoy the opportunity for low or no cost physical activity, and especially those who enjoyed going to trails or parks in the area. Kind of an interesting one this time around was that there was a pretty large emphasis on how communities and relationships have helped a lot during the pandemic. So that isn't just limited to like face-to-face interaction, that also includes online interactions, so social media or staying connected via Zoom. Folks really felt that helped them keep from feeling isolated. And I heard this across all the different focus groups. There was usually a mention that somebody had used social media to connect with their friends, their family, or meet new people, and just kind of stay sane, especially when it was hardest during lockdown and people weren't really going anywhere. Other folks had commented that they were able to spend more time with their immediate family, and that it helped them reconnect. So even though it's been a tough time for everybody, people were still able to find a silver lining there and get that connection that they didn't realize they were missing, but they were. On the flip side, the things that make it harder to be healthy, there are, of course, food deserts in the area. So some folks did feel like they were not able to find the fresh fruits, the fresh vegetables, or even a quality grocery store in the area, or it was hard to get to. There were things, especially in more urban areas, so limited spaces for physical activity, unfinished sidewalks, things that made it difficult to travel around or walk in the neighborhood. Affordable indoor exercise options, that was especially brought up during winter months. So like, of course, you can use the trails and parks during summer and fall and spring when it's nice enough out, but we have pretty cold winters, so folks were looking for an opportunity to do some indoor exercise that was affordable. In terms of safety, there were a number of mentions of people driving entirely too fast in all areas, and people very concerned about that. And then, gun violence, drug paraphernalia found in the area, in streets where people were living was mentioned. A concern was brought up for the number of marijuana dispensaries. I believe somebody was quoted as saying they thought there were more marijuana dispensaries in the area than there are parks. So it just was an interesting perspective, given probably where they live compared to other areas, but there sure are a lot of them. Even driving around, I have noticed them myself. And then housing, just an overall lack of affordable housing. The next thing was access to care. So a lot of folks felt like they do have problems accessing or getting their care. There were a number of folks who mentioned Medicaid and not being able to cover dental care or vision care, not being able to see a specialist or have them in the area, long appointments or waits, and then just generally costs being expensive, even for those who are covered or have insurance. There was some discussions about what makes a good provider, and I think most of us here would understand that people want providers who listen to them and who don't brush them off and don't tell them what to do, and speak in language that they understand and in a culturally competent way. There were some concerns about mental health in the area, language and cultural barriers, especially. Mentions that folks were looking for people who speak their language, which is a hard thing to meet, but it is definitely a concern for people. And then during COVID, it has, of course, become a lot harder to find providers when they were already stretched thin, and then you add in the pandemic, and it became that much harder for people to find the care they needed. And then our last concept map was about chronic disease. So a lot of people felt like their chronic diseases were, related to their environment, to where they grew up, living conditions there, lack of education around certain things, and especially when it came to being culturally sensitive, and telling people in a way that they understand and relate to. They do understand that diet and behaviors are part of it, but again, that goes back to the things that make it harder to be healthy. If you're surrounded by things that make it hard to be healthy, it is harder to be healthy. In terms of impact, people did sometimes have to change their activities. That was more so for folks who ended up with a disability or have a disability. And those who do have a disability, especially those that are, quote, invisible, felt like, they are seen and treated a little bit different than those who have a more obvious disability. And again, medication is something that came up in terms of cost and accessibility, even for those who do have health insurance coverage. A couple quick highlights from our community survey. So we had over 1,000 initial responses, and almost 980 of those were from our Tri-County region. It's probably no surprise to anybody here, but affordable healthcare and access to care were the top two factors for all three counties, and this was the same as last cycle. Two of the three counties listed mental health problems and access to care as their top problems, but alcohol and drug issues and obesity were also ranked very highly as well. When asked about what makes it hard to get care, cost of care was, again, unsurprisingly, top of the list. And nearly 80% of respondents had mentioned that addressing their social needs was as important as addressing their medical needs. And despite that, most people who were surveyed agree that they have the resources to stay healthy, but fewer people in Ingham and Eaton had strongly agreed versus mostly agreed. And again, in terms of accessing resources, the highest who said that they could access those resources was highest in Clinton County. In terms of our provider survey, there were 40 participants. The providers had mentioned that access to healthcare, healthy lifestyles, and low crime and safe neighborhoods were listed as their top three factors. They also had ranked lack of access to mental health services, lack of motivation to make health conscious decisions, and a lack of primary care physicians in the area as the top 3 things that they saw negatively affecting patients' health. The things they commonly refer to, community mental health, home care and hospice, community health clinics, and SUD treatment services. And most doctors did agree that addressing social needs is important as addressing medical conditions. All right, so with all that said, we're going to start switching towards our trial activity here. So we're going to be going through a few different things to do that. So it'll be a couple test votes, essentially. So this is designed to get you familiar with what is in the data overall, what is in the report, and then so that we could feel everybody feels that they are able to be ready for prioritization and know it's in there. And so we can move forward with that. Anne, have you put the links in the chat for the different things in case they haven't got it? So for everybody, I don't know if you can see it, but there should be the full report should be a PDF in the chat box. And I know, Anne, I sent you some links and you're gonna.
Yeah, so sorry, I had to unmute. I did,
yeah.
I did put the link to the document itself, as well as a link to the data packets and worksheets. So the difference between the full report and the data packets is that the data packets are essentially subject by subject. Is that correct, Chris?
Yes. So when we go into our final vote, we are voting on what we're calling our categories or priority categories. So they are rounding up the different measures and calling them, like, kind of grouping them so that we don't have to go through 32 different measures, 31 different measures. We'll be voting on 17 different groups instead. So those are broken down, as Anne said, in each packet. So you can take a look at whichever ones you want, the individual, all of them, it's up to you. We want to make sure that you have access to them for this.
Okay, so the link that I just posted is to this tool that Chris is using called Mentimeter. And it's kind of a voting platform, but it also has the presentation built into it somehow. I'm not sure exactly how it works, but the voting platform is that will be on that link that I just shared.
Yes. So I will get to that in just a second too.
Okay.
So before we do that, I just wanted to talk a little bit more about what we're going through. So these are the 4 criteria that we are going to use for our actual prioritization vote. They're the same as last cycle for those who have seen it before, but for those who haven't, we break it out by the 4 things. We have 4 individual votes, and then we weight those votes and we'll have a final prioritization list. So those 4 areas, the 4 categories are seriousness. So how serious do you think that the issue is going to be? Control. So how much control do we as a community at large have to affect that issue? Or sorry, that's the next one. I'm not really sure what the difference between control and capacity is. Anne, do you have any better information on that?
Yeah, capacity is are the resources that we have to actually do anything. So you might have a really well-developed coalition, for example, in a particular area, and that would indicate that you have a lot of capacity. That's different than control, where that's something that that's a subject you can identify where you can say, you know what, we have a lot of control over this particular issue.
Thank you. And then catalytic is just how much does this issue affect other issues? So there are, of course, those topics that can cascade down, and so they affect other issues, and that is certainly an area we wanted to include as our to think through. So as Anne mentioned, we're going to be using Mentimeter. She has put the link in there. So if you go to it right now, what you'll see is the presentation in a smaller view. But when I go to the next slide, it will show you the voting. And then to go through the voting, you will have to either click on the link, or there will be another set of instructions on the next one where you'll go to menti.com and then put in the activity code and you'll get to the same place. So either way, it'll work. The way the voting is going to work is for the first test vote, you'll see 5 of our of our priority groups. And then you'll just vote on which ones, we'll give you a couple minutes to look through the packet. And then you can vote on those to see which you think is kind of most important. You don't have to think about them in terms of the 4 things right now, but try to keep that in the back of your mind, just to kind of shape the way you're thinking for the final prioritization vote. The way that the voting is going to work when you get into it is you will have 100 points to assign however you want to the 5 options, and then in future votes 4. So you can divide that up however you want. You can do 20 each. You can do 100 points to 1. You can divide it up however you want. We generally would ask that you divide them up, but it is up to you in the end. So with that said, let's give it a shot.
And don't panic, anyone. This is just practice.
Yes.
So
So as
practice with a purpose.
Exactly. So as you see, you can do it either way. So Anne's link, or at the top, there's meti.com. So, if you're on your computer, you can open up another link. You can do it on your phone. It works well on your phone too. So either way, it'll work. And I'll give folks about, let's call it 3 minutes or so. And then I'll pop a countdown timer on there, and then we'll see how it goes. And if you have any questions while you're looking through it, feel free to ask as well.
Hey, Chris, can you?
Yes.
Can you? And I can't remember this myself, so that's why I'm asking. Why did we pick these particular 5 things to be grouped together?
There was no rhyme or reason for this one. It was just for these test
random.
votes.
Okay.
It's random. Yeah, it's just we wanted to test out the voting system and help people look through the report, just to give them a different flavor of everything. So this is just random.
So I got a question. The question is, what are we answering with this? So we are, what we're going to be doing is we're going to be going through all of the priority areas in several different trial votes, and you're going to be comparing them to each other, but just these 5. And so it'll make it a little bit more manageable to compare these things. And what we're hoping is you'll get familiarized with the data. We hope that you read the report, but even if you didn't, you can take a look at the summary table. But the point is that it's kind of like, I don't know if some of you remember last time we did a bracket activity where we had people compare the measures to each other, and then we went through this pretend bracket. And that's essentially the purpose of this particular activity, is to just get people looking at the data and thinking about the data in preparation for the final vote. So that's why we're calling this a trial, because it's not, it's not binding, but it's meant for discussion and conversation. Norma is having an issue. Chris, do you know the answer to that?
I am not sure. I mean, I would try to go back in and see if it would let you. I know when I had done it, it wouldn't let me submit without 100 points. I would try to go in and see if it would let you do it. All right, so we have about 32 responses. I'm going to try to start a 1-minute countdown. And then after that, I will close voting, and then we'll look at our results.
So Norma, what I hope is that when we move to the next vote, it'll reset for you.
Yes, for the next vote, it'll be a whole different thing. So there we go. 29% of people had assigned their points to say that affordable housing was the biggest priority out of this list. And I'm kind of happy to see that things are more grouped up than I kind of had expected them to be. So I'm glad it seems like people are spreading their votes out. Yeah, so we'll go on to our next one. So we're going to do a few of these, and then we'll have a couple minutes to chat just kind of about how it went and how we feel about it, and talk about the data a little bit more. So you should have another vote up there now. So feel free to start voting, and we'll do a little bit shorter this time because hopefully everybody is a little more used to it. So we'll close it around 10:35, so in 2 minutes.
And when it talks about education, this is formal education, not health education specific.
Yes, it is. It is folks who have a bachelor's degree over 25 years of age.
Hey, Chris.
Yes.
I entered 90 votes just to try what would happen if I entered less than 100, and a message popped up that I had not used up all of my votes. And so I could cancel that and go back and use the extra that I hadn't used and then complete the process. So that worked well.
Well, there's your answer. So thank you, Rex. Appreciate that.
Chris, I am getting a message at the bottom of this ghost page where it says presenter has closed voting. Oh, did you close the voting? Okay, sorry.
Yes, I did. So, of these that were here, I don't think anybody is probably too surprised, but healthcare access and quality came in. That is traditionally one of our priorities for the way the vote ends up being. All right, we'll do a couple more and then we can discuss a little bit. So we'll do another quick one and then another vote after that and then our discussion. So feel free to start voting. Oh. We don't want to pile on votes, anybody.
And Norma, there's some good suggestions from Peggy and Joni in the chat. Thank you guys for trying to help.
countdown, and then it will close. I think unsurprisingly, chronic disease and community safety came on top. All right, one more test vote, and then we can have a bit of a discussion just about everything.
And I do want to say, I know we totally recognize that this is very difficult. You know, this whole prioritization process of picking these issues versus these other issues that everybody agrees are, you know, many of these things are things that need to be improved. And so it feels often really hard to say what's important, nutrition or finance. And we also know that they are intricately linked together. So keep that in mind. So we'll be able, when we get to the final vote, we'll be able to kind of acknowledge that in our final votes that we do. But certainly, you know, it's a classic problem, you know, when we're doing prioritization to say, you know, do we prioritize infant mortality or heart disease? You know, they're both bad. So, but ultimately we do need to come up with something. So, so that's why we do this activity.
Okay, behavioral health and financial stability.
I do want to clarify that when we say behavioral health, we mean mental health as well as substance misuse.
Yes, so for a detailed explanation of each of the categories, there is the priority category guide in one of the links that Anne had provided. That would have kind of all the measures that are rounded up into each of those areas, in case that was a question. All right. And now we have a chance to kind of discuss, you know, what we just went through. So we have the measures that came out, but I think the first question that I want to ask and just get a feel on is, do people feel like it helped to, you know, get through the report, to familiarize yourself with the data? You know, did it work for you?
Was there anything surprising about which ones won?
It didn't work for me because I come from a community standpoint, not a healthcare provider standpoint. And so I sort of discounted anything that are the results of the social determinants of healthcare, the racism crisis, and emphasize the ones that I see as things that we have control over.
Yeah, I was surprised that affordable housing came out on top. I don't know that we've ever had this group prioritize housing. So that's really exciting to me.
That was the biggest surprise to me as well. I mean, it makes some sense because, especially right now, I mean, we know, you know, how the housing market has been, and in other areas that, you know, there aren't as many people who want to be landlords or renters, and prices of homes is extremely high. So, you know, even in places you would think it is affordable, it is more of a challenge now than it certainly has been in the past.
Our providers up in Clinton County, we have a ton of money, but it doesn't matter if there's no housing. Like if you don't have the infrastructure for the housing, it doesn't matter if we throw money at the problem, there's nobody to take it and hand over a house. So it doesn't surprise me in the least. It's a conversation at every single meeting.
I would also mention that those first couple of trials, I was playing around with the responses to just knowing that there were trials. So my vote may change.
Well, no, I mean, that's what we want. We want people to be able to, know what they're going to get out of it. So that is the whole point of it.
Yeah.
Yeah, I will say it was interesting, maybe because of how much time I personally spend on communicable disease these days, how it didn't come out on top. But I totally understand, because it usually doesn't. It's usually way down the list. And I think maybe everyone's ready for it to be way down the list again.
Well, there isn't a specific COVID measure. I think maybe if there was a specific COVID measure, that would be far and away the number one, but who knows?
True.
And there's some comments, in case you're not following the chat, folks are talking about increase in homelessness, shelters are full, people are looking for housing for refugees and there's nothing to find. Yeah, that's absolutely the case in Eaton County as well. Housing is very tight. So, oh, and Leanna, absolutely, and Clinton, thank you for that. One thing that I wanted to bring up and really to acknowledge sort of Norma's point, when you look at the categories, we don't have a category for health equity or racism and things like that. And the reason for that is, in the past, we had included those into all of our different prioritizations. However, I do want to offer that if this group, now we haven't added it to the list, but if this group at the end of our day feels really strongly that we do want to add that in as a priority, I am open to having that conversation. So I do know that quite often when you sort of name health equity as a thing, then the question becomes, well, then what do we do about it? And then you have to start getting into the nitty-gritty anyway. So our approach in the past has always been to incorporate it into the topic areas that we were working on. But certainly I do want to acknowledge that was an excellent point. And Michelle points out that they've been asked to provide masks, sanitizers, wipes for the area's homeless shelters. And I believe there's a big COVID outbreak in homeless shelters right now. And unfortunately, the funding for that has gone away. So from a public health standpoint, which is unfortunate.
All right. So does anybody have any other issues they want to bring up about how the voting went, or how they felt it was to use Mentimeter or anything before we? Well, first we were going to take a little break, and then we would get into prioritization. So now would be the time to bring something up.
It's interesting to me that this process started before the worst of the COVID pandemic. And just a week or two ago, the Lansing School District ran a crucial conversation about safety at Everett School. And it came out that Lansing has been found the 9th most violent city for gun safety last year. So I think if these focus groups were held today, I know everybody at that meeting, which is just an outlier, maybe, I don't know, it's not as general as the entire population, but the community safety is big. I have 1,200 Facebook friends, and everybody's afraid of gun safety, gun violence. I think 84% of Americans want sensible gun control laws. We don't have control over that. But it's the delay, these 2-year planning processes are 2 years out of sync with current events. And sometimes you have to readjust to deal with current realities, in my opinion.
Yeah, so our focus groups were conducted this summer. So, but keep in mind, they were conducted with people across the 3 counties, so not just with people in Lansing. So I would say in general, people from Lansing tend to identify gun safety or gun violence as an issue, and people in outlying areas tend not to see that as big of an issue. But yeah, I do think that one of the challenges we always have with health assessments is that the 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 quantitative data, the data that we're pulling from, the systems, none of that is really data. It's usually from 2019 or something like that. So a lot of it is pre-pandemic. So we won't really be able to see the impact of the pandemic in some of our quantitative measures um, until the next cycle, unfortunately.
The national statistics from the Universal Crime Report says gun violence has increased all over the country.
Okay, thank you, Norma. So with that said, let's take, it's a 5-minute break. So let's be back at 10:55. So if in case somebody needs a refreshment, and then we will go through with our actual prioritization vote. So see everybody in a couple minutes. Okay, it is 10:55. So I will give everybody about another minute after hearing my voice to get reacquainted and readjusted, and then we'll dive right in. Okay, well, I don't know about everybody else, but I am ready to do this. So I will once again go over the process and what we're going to be doing, just to make sure we're on the same page before we do our real votes. So this time around, this is going to be the real prioritization process. So we will be doing 4 separate votes, 1 for each area. So seriousness, control, capacity, catalytic. If I'm remembering correctly, those definitions are on each of the slides, but we can remind you what they are if we get to them, if anybody has any questions. We're going to go through each one independently. Again, each one of those individual categories independently. So 4 votes, all 17 measures. You may need to scroll down because you only had 5 last time. So you will have to probably scroll down to see all of them. And they are all randomized, so the same ones won't be in the same order, just to make sure people aren't clicking on the first 5. So I do encourage you, if you don't see what you want, to look all the way through the list to make sure you get to it. And these are our categories. So these are all the ones that you've seen, you've been going through. Again, these are the ones that are in the prioritization guide that have all the measures tied to them with an explanation of what they are. We've gone through our votes, so I'm guessing at this point most people know what they are looking for. But before we jump in, does anybody have any last questions about what we're doing, or what the categories mean, or what's in them, or any other important information they need clarified before we jump in? All right, 5, 4, 3, 2, 1. All right, let's go on in. So our first vote, there it is, will be on seriousness. So how much of an impact does this have on health? And I will give people a pretty good amount of time here. So either 5 minutes, or I see about 30 to 35 votes before I start the countdown. So with this one, please take your time, and start your voting.
Yeah, and this is a little bit different kind of method than we've done in the past. So in the past, you would just pick 3. But this time you can actually put a weight to, to what you're doing. So we'd ask that you pick at least 3, but you can pick more than 3 if you would like to. And then you can certainly divide up your points, so to speak, however you see fit. And again, keep in mind that we're just asking you to consider seriousness. How much of an impact does this have on health for the communities of Ingham, Eaton, and Clinton counties?
All right, I see about 30 votes. So I'm going to start our 1-minute countdown. So hopefully folks will keep wrapping up.
So I have to ask Chris, what is this a picture of on the left side of the screen?
So for this, this lets
A
you,
little, like,
it
cardboard box?
has a search engine for pictures, and I was honestly just searching like Halloween seriousness. And I tried to find something that wasn't particularly frightening and maybe a little funny or cute, and this is where we ended up.
It's very cute.
I enjoyed the one earlier with the ghost who was wearing sunglasses. That was my favorite one. Okay, voting closed. Let's see what we got. All right, looks like healthcare access and quality, behavioral health, affordable housing, financial stability and economic mobility, community safety, chronic disease as the ones with the highest percentage. And this is where I need you to be putting down the places they're in into the spreadsheet.
Yes. So hold on, I need to get over to Mentimeter so I can actually read these things.
Yeah. So, so just so everybody knows what we're doing, as part of this, we have a spreadsheet on the other side that we can't see right now that is tracking each individual vote. So Anne is putting in the place they are in, so first, second, third, fourth, etc. And then we have weightings that we're applying to them, both upstream and downstream weights, which we can talk about after we finish the vote. And then once we're done voting, that will give us our priorities. So we'll see the difference between them, and then we will have, they'll probably be pretty close, if not match. And then we'll have our priorities from that, which we can discuss.
Okay, Chris, I'm gonna need you to read them to me because I can't see it on the Mentimeter voting page.
Okay.
So what I will do is I will just read out the things on the spreadsheet and then you can tell me what the score is. So financial stability.
Oh boy. Okay.
I'm hoping you can
4.
see this bigger than me.
Not really. 4th.
Okay. Affordable housing,
3rd.
education,
8th.
social connection,
11.
community safety,
5.
healthcare access and quality,
1.
environmental quality,
13.
built environment,
14.
obesity,
7.
tobacco,
Uh, 16.
behavioral health,
2.
physical activity,
9.
nutrition,
10.
communicable diseases,
12.
maternal and child health,
15.
chronic disease,
6.
accidental injury.
17.
That's it.
All right, we did it. Did number 1. Okay, so we'll move on to our second vote. This one is capacity. So hopefully it'll switch in a second. There we go. So what is our ability as a community to address this issue? So infrastructure, things other than that. And do you have a better explanation again?
This is our collective capacity to work on these issues. So this might mean infrastructure of the community, political will. It might mean a lot of interested people ready to take action, as well as resources available to take action.
Thank you. And again, I will start closing or put the countdown timer on for a minute when we get around 30 responses. So plenty of time for everybody to look through.
I just resend out the Mentimeter link in case anyone has lost it. There you go.
All right, we're over 30, so I'm going to start our countdown. So this time our top 5 are healthcare access quality, community safety, behavioral health, chronic disease, and affordable housing. So Anne, let me know when you're
Okay.
ready.
And this is capacity, right?
Yes, it is.
All right, financial stability,
14,
okay. Affordable housing,
5,
education,
7,
social connection,
8,
community safety,
2,
healthcare access and quality,
1,
environmental quality,
15,
built environment,
11,
obesity,
13,
tobacco,
16,
behavioral health,
3,
physical activity,
6,
nutrition,
10,
communicable diseases,
12,
maternal and child health,
9,
chronic disease,
4,
I missed that. What'd you say?
4,
Accidental injury,
17.
that's it.
Okay. All right, next vote. So this one is control. How much control do we have to affect the issues? And again, same voting process. So 30 votes, I'll start our countdown and we'll do it. 30 votes. I'm going to start our countdown for a minute. Maybe. Okay. Votes. There we go. So our top 5 this time for control are healthcare access and quality, community safety, behavioral health, affordable housing, and social connection and capital.
Okay, I'm unmuted now.
Okay.
Financial stability
16. Or yes, 16.
for control, right? Yeah. Affordable
Control.
housing,
4.
education,
7.
social connection and capital,
5.
community safety,
2.
healthcare access and quality,
1.
environmental quality,
8.
built environment,
6.
obesity,
15.
tobacco,
14.
behavioral health,
3.
physical activity,
9.
nutrition,
10.
communicable diseases,
11.
maternal and child health,
13.
chronic disease,
12.
accidental injury.
17.
All right.
Almost there, everybody. One more time. So our last vote, when it pops up, there it is, catalytic. So how much does this issue affect other health issues? So yeah, hopefully that's explanatory enough. So let's go ahead and get started. Again, 30 votes. When I see that, I'll start our timer. And then after that, we'll have our priorities.
So another way to think about this, about catalyticness, is if we address this problem, a bunch of other problems would take care of themselves. So how catalytic is this particular issue? And I will give you a hint that usually social determinants of health are considered to be pretty catalytic.
Started a 1-minute countdown. More seconds and we're done voting. All right. Top 5: healthcare access and quality, affordable housing, financial stability and economic mobility, behavioral health and community safety.
Okay. One more time, everybody. Sorry to make you have to listen to this. Financial stability,
3,
affordable housing,
2,
education,
7,
social connection,
10,
community safety,
5,
healthcare access and quality,
1,
environmental quality,
12,
built environment,
8,
obesity,
11,
tobacco,
13,
behavioral health,
4,
physical activity,
15,
nutrition,
6,
communicable diseases,
16,
maternal and child health,
14,
chronic disease,
9,
accidental injury.
17.
All right, that is it for that part. Now I have to
Okay.
do some number crunching.
It should do it automatically.
Oh, yes.
I mean, you just have to like sort them, but that's it.
Okay.
So while Anne pulls that up, she's doing the tallying and the weighting. We did that. And so our final thing, Anne, if you have it ready, you can share your screen. That should take it from me.
Oh, there's some legacy color coding here that I have to.
Okay.
Hold on.
Barbara Fulton said, I highly recommend the book Upstream by Dan Held. if you haven't already read it. And,
Please put that
it
in the
said, I asked participants to consider whether a factor is a cause of a problem or a result of a systematic racism crisis.
Thank you. And do you want me to go over our last couple steps, and then we can share at the end?
Yeah, that's fine. I'm really happy that no one's watching me struggle with Excel right now, but a couple minutes, hold on.
Okay. So while Anne finishes that, we are going to leave you guys with those upstream and downstream votes. So don't worry, we'll have those. But so in the end, what remains for our 21-21 project? So we have our results. Anne's going to share them with us. They will be added to the final Healthy Capital Counties report. So that's the big one that is on the website. And we'll also be adding accessibility options. So after today, I will write up a summary that will go into the report. The accessibility options, which is mainly alternative text for like readers, will go in there as well. And we hope to have that report completely final by mid-November, certainly before the holiday period. I will send out an email when that is ready to everybody here, and then we will, release it wide for public consumption, more so than it has already. And then we will begin thinking about our community health improvement planning and implementation process, which will kick off mostly in earnest starting around January 2022. So these are some examples of what we have used the CHNAs before. So they've been used as resource or service development tools. They've used to educate management, board members, or staff in the community, reporting requirements, grant applications, data dashboards, student projects, patient barriers in urban and rural environments. It seems like prompted changes to behavioral health inpatient processes, and to give a regional perspective to all those things going on. And there are plenty of other ways to use it as well. Those are just a few examples of what we have done in the past. You ready, Anne?
Oh, I'm getting there. Hold on.
Okay.
What I'm
No pressure.
trying to do, just so people are familiar with what I'm trying to do, is I'm trying to see how much consensus there is between the top 5 in each category. So I think what I'm going to do is I'm just going to go ahead and share my screen so you guys can see what I'm looking at, and then we can have some discussion. Okay, so you're not going to see you're going to see my stuff now, I think. Hold on. Okay, can you guys see these numbers?
I can, yes.
Yes.
Okay, so hold on, I got to get the Zoom thing out of the way so I can see it. So these are the upstream top ranking things. So this is because we use rankings here, it's kind of like a golf score, I guess. I don't play golf, but the lowest score wins, basically. So I was sorting these based on this. So according to that, healthcare access and quality, community safety, behavioral health, affordable housing, and education came on top for upstream. And then downstream, scroll down here, we had healthcare access and quality, behavioral health, affordable housing, community safety, and education. So I think those are the same. Yep. So, in the past, we've had 5 categories. So I guess what I would like to know is, would you guys like to pare that down? Would you like to go with only 4 priority areas instead of 5? How strongly do you guys feel about including education as a community health priority? And again, that means getting people educated, not educating people about health.
And could you do a quick upstream versus downstream and what that means?
Yeah, sorry. So upstream means that we put more emphasis, or we put more weight on catalyticness. So let me scroll up to where that is. Okay. So again, in this, it's important to understand that smaller means better. So here, seriousness was the most important factor that went into these weights, then catalyticness, then control, then capacity. So we're focusing in the upstream weight, on the upstream method of weighting. We're focusing on things that are catalytic, more catalytic. It's still going to be highly influenced by what people put for seriousness. We're not getting away from that, but it's a little bit, that's why you see a little bit different order. And for downstream, we're weighting capacity. So these are things that people feel like we have the action to take now, and we're still considering catalyticness, but not as much as capacity or control. So I hope that is helpful. So what I'm seeing here is certainly healthcare access and quality, behavioral health, affordable housing, top, and community safety were sort of our top 4, and education is our top 5 in both of these scenarios. And again, these are only the top 5. Like I could go way down the list and show you this, and we will show the scores in the final document of all the different measures that people voted on.
Nikki, to your question, it only includes the measure specifically for education is adults over the age of 25 who have at least a bachelor's degree. So the higher education piece.
Yeah, I do think that it's worth the question of for the people who were voting that way, how did you guys, consider it? Were you considering K-12 education or pre-K or whatever? Usually people do, because that early education may lead to further education, but yeah. Any strong feelings either way about how many of these we should include as priorities? Joni was thinking about post-secondary. Great. Thanks, Joni.
I wonder if people put a lot of emphasis on the value of education because they think humans make decisions on the basis of what they cognitively know. But I think a lot of our social problems come from our emotional decisions and our lack of community connectedness. So we see some very well-educated people who make some really lousy, bad mistakes and are involved in lawsuits. That's just my observation.
Leslie, you raised your hand.
Yeah, I would propose that we cut down to 4 community health priorities, as representing the health system and knowing that the next step will be to write a strategy on addressing these community priorities. I think it's more manageable if we are looking at 4.
So with some cameras on, I'm seeing some head nodding. Here, I will make a quick poll because why not? We haven't voted enough today to see if people want to do 5 or 4.
Oh, and Amanda has a good point that there is a big jump between the score for community safety and for education, at least in that one. Let's see.
Yes, both upstream and downstream.
Yeah, you're right. So yeah, we have affordable housing here and then a big jump to education.
Okay, maybe then we don't need a poll. So it seems like people seem fairly happy with 4 with the big jump as well.
Okay, so here's what I think is really exciting about this, and I'll stop sharing my so we don't have to keep staring at that. And I can see everybody again. I'll just reflect. I think it's really exciting. We have 2 new ones we've not had before. We've got community safety and affordable housing, which are both really great communities focuses for public health and for healthcare. I think as well, we've got our classic access to care and behavioral health, which we have been really focusing on for the last several years. So it'll be really great to keep working on those particular issues as well. And then the sort of parting thing I just want to make sure that everyone understands is that we do have a number of coalitions and community groups that are working on many of these topics. So even if they didn't get selected, so to speak, we still have a lot of community groups working on these. And if you are interested in joining any of these coalitions, we have a perinatal quality improvement collaborative, for example, in the Capital Region now. We have substance abuse prevention coalitions or substance misuse prevention coalitions. We've got a lot of community organizations and community partners coming together to work on these things, and they would really value more engagement and more participation. We have Great Start collaboratives focusing on 0 to 8 and school readiness. Get a lot of these different initiatives. So I do think that we will, one of the things we'll do in the new year is try to make sure that we're educating people in this group so that you know that you can join some of these groups and which groups there are that if you're interested. The other thing that we will be doing, and I know Chris probably talked about this, was we will be reaching back out to this group, the whole broad group for Healthy Capital Counties, as we get started our community health improvement planning process. And that will happen most likely in the new year. And we will be getting back together and trying to come up with how are we going to address these things. So for those of you that don't know, hospital systems and health departments have to come up with strategies that we are going to implement. And we also have an opportunity to work with other coalitions and others in the community to do things together, which is going to maximize the impact that we have. So those are both things I'm excited about. I know that in public health and in healthcare, we've been focusing on COVID for a year and a half, more than a year and a half, and it's been very, very challenging. So the ability to work on some of these new projects and new concepts and revisit some of our old ones and re-energize them will be really, really great. And Norma has some suggestions about My Brother's Keeper at One Love Global and micro enterprises coaching at the Fledge contribute to economic stability. And Nikki loves the idea of cataloging better which groups have work going on. And I do think that that's something that I don't think we've done in a long time. So I love that suggestion coming out of this meeting. I have some interns that I think I will assign to work on this because it sounds like a great intern project to me to get that info out to all of you. Leslie, did you want to, or is that a legacy hand?
With that, well, this is my 4th time through also, and what I'm realizing is this is the first time that chronic disease or obesity has not made the list of top 5 health priorities for our community. And, this is the first time we've seen more social determinants of health factors outweigh traditional health, such as access and obesity. So it's pretty interesting if you've been with this process for this long, because what I'm taking this is, it is not that obesity and chronic disease aren't issues anymore. I think as a community, we're starting to realize that these broader social determinants do have the impact on the obesity and the chronic disease rate. So, from a hospital perspective, this is really interesting times, because we have to go now and take a look at these and decide how we're going to address them and what we're going to address. And it becomes really interesting if your primary work is healthcare and the things that you're supposed to be addressing aren't necessarily directly tied to health. So this is the first time this has happened since we started.
Well, and thank you, Leslie, for that. And I really want to say thank you to everybody who has participated today. Your engagement has been amazing. I'm really glad, Norma, we will be getting in contact with you so that we can make sure to include your resources that you have connected us to. And I do think that, you know, we are, you know, this whole cycle has been virtual. So I just want to say thank you to everybody for sticking through it. It's much more fun when we get together in person and get to do the data party and get to do the voting with little beads and stuff like that, like we've done in the past. But thank you everybody for sticking through it. Any other comments, Chris?
No, you covered everything else. So again, thank you, everybody. We do understand it has been challenging to do this virtually. You know, at least when you're in person, you get food and not your own food while you're sitting here. So maybe one day, hopefully by the next time we do this, we'll be able to do some of it in person again. But again, thank you. Thank you, everybody, for joining. And we'll stick around for a few minutes if anybody has questions. And other than that, thank you and have a good rest of your day.
Thanks, guys. You guys made this fun, even virtually. Doing the road trip through Michigan really kept people engaged. Being able to use Menti today for voting and practicing, I think that you guys handled this really well. And you know, it's not as exciting as being in person with everyone and having all the fun in-person tools, but I think that your team did a really great job through this process. And I really appreciate the effort that you put into that to help keep the rest of us engaged as we worked through it. So thank you.
Thanks,
Well
Kelly.
done, guys.
And I do want to mention that the full report, so we will have that written up, I would say, and probably, well, we got to send it to the graphic design people, probably in a couple of weeks. And we will send another email when that final version is created. I have to look to see whether we have any budget for print versions of these. And if we do, I will let you guys know. What?
We should. I believe
Okay.
there is.
Yeah, so those will be available after the final version is compiled. The other thing I forgot to mention, now that we've dismissed everybody, is if you have a group where you would like us to come and do a presentation, virtually, I guess, or in person, we'll do in person, we'll just wear our masks. We are happy to come and present the results of the community health assessment. Obviously, it's just a highlight kind of thing. It's not the full thing because that would take probably a couple hours. But if you're interested in having us come and present to your group, we usually will, depending on what group it is, if it's an Ingham-based group, we'll have Ingham County come with us to do that, or Mid-Michigan District if it's Clinton, so that we can make sure to have your folks on site at that particular event. But yeah, we're happy to do that. Thanks, everybody.